I'm going to go ahead and introduce Ivy, and if you will properly introduce Dr. Sally for us.
So we're privileged tonight to be hosting our very own Dr. Sally. Dr. Sally is the owner of State Line Animal Hospital. And we met her a couple years ago when I was looking for an integrated veterinarian for our 3 puppies. And I found Dr. Sally to be a great caring veterinarian. She's a very flexible, a good listener, and we've really enjoyed getting to know her. So we want to welcome her tonight.
Okay. All right. Hi, everybody. Dr. Sally Barchman, State Line Animal Hospital. Hi, everybody on Zoom. So congratulations to everybody on their awards. I have Great Danes. They have the PCH, professional couch hogs. That's pretty much all they do. They don't do anything cool like that. But I chose that breed because I have a lot to do, so I don't have time to do this awesome stuff that you guys are doing. So it's always a pleasure to have Goldens come in because they're always just the best patients. So, well, so I don't know if it was you or somebody made a handout, but it's amazing. Yeah. And so I hardly had to do anything. We're just going to go over that because it's very thorough. So first aid kits are a great idea. I actually went maybe my first year out of vet school. My husband at the time and I went on a 3-day camping trip and we took our dog and I didn't think about anything. I didn't take anything and he had kind of an allergic reaction. He got bit by horse flies and his face kind of got swollen and we happened to meet someone on the trail who had Benadryl. So I kind of learned my lesson. I was very naive to think that, you know, I wouldn't need anything like that. So that was very silly. But so now I have a pack. But I also have kids, so less likely to do anything fun like that for a little bit with my pets right now. Okay, so we'll kind of just go through this. You can buy pre-made packs that have a lot of this stuff in it. But I wanted to go over a couple things that you might want to know, especially like if you're taking a trip where you're going to be gone a few days. I would definitely do some research on knowing where an ER hospital is, just in case. If there's something close, then you can always call them or go there if you need to. And a lot of vets now have telemedicine apps too, or maybe they might give you their cell phone or, you know, something like that. But it always is a good idea to have. We have a telemedicine app that you can contact us after hours and ask questions. And that's just like a little lifeline to have. It's a really good idea. You know, just in case you have a question, you don't know what to do and you can't get to an ER hospital. But there's a lot of stuff that you can do yourself too. So, so we'll just kind of go down the line to make it easy, but I just brought some things you can. So, you know, this time of year, ticks are everywhere. They carry disease. You know, a lot of people use prevention, but if you don't, you want to look over your pet if you're out in the woods, especially the belly or the non-haired regions, under the chin, around under the tail. But they do sell things like this. It's a tick puller, and basically it just has a little notch here so that you can get the head out too, because a lot of people will try to just pull it out and then you leave the head in and they can get infection, and that's stuck in there until it kind of works its way out. So you can buy these at pet stores, or your vet usually sells them. This is called Ticked Off, but you can get them online. It's pretty cute, clever. And you know, everybody usually has this type of stuff for themselves, but you want to have some 4x4 gauze. But I also would recommend having some non-stick Telfa, because if there's a wound, this is going to stick to it. And then when you pull it off, it's going to open the wound again. So you want some non-stick. It's called Telfa pad too. And you can get all this. This is human stuff that you can get at CVS or Walgreens. I like this stretchy, it's called Cling. It's stretchy gauze you can wrap this too tight, but you can use this. It also says in here if your pet gets injured, sometimes they're going to be painful. So you can use this, I like, to make a little muzzle. And it's stretchy and doesn't hurt. Oh, you don't want to be muzzled, do you? No, but you just kind of tighten that over there if you needed to. This I don't like to wrap with much because you can really cut off circulation because it can get too tight. But it's a nice thing to have if basically you're just trying to do something enough to get to a vet hospital, obviously, if there's a big wound. And then of course this is called vet wrap, but you can get this anywhere as well. It sticks to itself. It's easy to tear. The one big thing I want to say about wrapping, if you're on the paw, you basically want to start away from the heart and you wrap up towards the heart because you want to push blood flow this way. If you wrap too tight, you can cut off circulation. And if you go away from the heart, you're going to trap blood down in there and they'll get swollen toes. And so you want to wrap farthest away and wrap up on the extremities. A lot of places you can't wrap, and dog back legs are difficult because they're bigger up here and smaller down there. So sometimes you can't get things to stay, but this is the best thing to have. And it comes in 2-inch or 4-inch and you can get that anywhere. Disinfectant, basically it mentions rubbing alcohol. It's not a bad thing, but it stings just like you would, we all grew up with Bactine, that hurts. Betadine is a better thing, or there's something called chlorhexidine scrub that you can use. It's a surgical scrub that you can get as well. That's a better option for open wounds. Hydrogen peroxide is kind of some people say to use it, some people don't. Bubbling is not, it's just dissolving the blood. It's not really cleaning out the wound. So I usually don't use it on wounds, but you can if it was really dirty and you had no other liquid. So, but I prefer not to use that really on the wounds. Digital thermometer, those are really hard to find right now after COVID. But if you have a dog thermometer, most people do, you take rectal temperatures, and I don't know if that's 100% necessary because it's good to have, but there's not much you're going to do about a fever. You're going to try to go to a vet, so if he or she has one or not, that's not a huge deal. Dog boots are great. I'm sure a lot of you have them. I don't have a favorite brand. I think they've written, Muttlux and Paws dog boots. I've had people use tons of different kinds and whatever works for your pet, but that's not one that I would say is huge. If you're going to be out and hiking in bad weather, then I would definitely have those with you. But that does protect their feet too. If you're doing some rocky climbing or something like that, that would be a good idea. But you have to see if they'll walk in them. It might be a trip hazard if you put them on and try to make them go hiking. Half of them kind of walk like this, and so yeah. So I don't know. The styptic pencil I think is a great idea. We also sell something called Quick Stop, where you can get it online. It's a powder. It's just not really a pencil, it's just a big tub of powder, and you can use that to put on torn toenails. You don't really want to put it on wounds. You could put it, if you get a laceration on an ear, I would use that just because they bleed so much that it's very difficult to get them to stop. So you could use a styptic pencil or Quick Stop on that. That is a little bit stingy, but I would stick probably to use that with toenails or an ear wound, basically, just because they bleed so much. If you, just on a side note, cornstarch or any kind of powder you're basically just trying to make a clot. So if you didn't have any of the quick stop, you could use cornstarch or some type of powder just to get some bleeding to stop. Because sometimes if they tear a toenail, it looks like, you know, a murder scene. And so if you have, you know, any type of powder can help in that situation. This says a medical stapler. That's not a bad idea, but a lot of wounds that happen out on that are accidental, you really don't want to close because you can trap infection in there. And so, you know, it's not a bad thing, but you don't want to close a dirty wound. So I would usually just leave them open, kind of try to wash it out and get the appropriate care. Yeah, I can't really think of a way you would, when you would want to, because you're going to be out and about, and most of the time that happens, it's dirty wound. So I probably wouldn't use a stapler. Wound spray is a great idea. There's a Vetericyn has one. You can kind of buy them anywhere, or you can get them from your vet. Neosporin isn't a bad idea either, just to have some type of ointment. Any kind of, it's the same thing you would use on your wounds, you can use on their wounds. So antihistamine is a great idea. Like I said, I was thankful we met that person on the trail because my dog had hives and I had nothing with me. The dose of Benadryl is a milligram per pound. You can even give it 2 to 3 times a day. So say they're 25 milligrams. If you have a 50-pound golden, you would give 2 tablets. You can give double that dose. So, you know, it's really safe. Basically, the side effect is drowsiness. Some dogs do react like children, though, and they can be hyper on it as well. Or they can act like nothing happened. So Benadryl is really safe. You can't really give too much. You're not going to hurt them. And you're trying to stop a reaction is basically what you would want to use it for. Hydrogen peroxide is a good idea, especially if they eat something that you want to get up right away. If they get into a carcass, that can make them really sick, or if they swallowed a corn cob or something. I mean, you want to get that out of there right away. Again, that dose, you can't really give too much. You're just going to make them vomit. You want to give it to effect. So I typically, for a golden, you'd probably give 3 to 5 tablespoons. The hard part is getting them to drink it. So a lot of people will use like a turkey baster to, you know, just squeeze it in their mouth because it's kind of hard to hold their mouth open and pour it in, and, you know, and it tastes really bad. So, and you can use quite a bit of that if you really know that they ate something that you need to get out right away of the stomach. You have about a 30-minute window, you know, so if they ate one of your medications or something like that, you have about 30 minutes before they just, you know, absorb or it moves further down the GI tract. You really want to do it as soon as possible. Skin and paw balm is a great idea as well. They have on here, you can use anything you'd use. They have a brand on here, anything you'd use for yourself. You can use coconut oil. You can use bag balm. There's also something called Musher's Secret, which helps put a barrier on their feet, especially if you're out in the snow or there could be ice. Salt from, you know, trying to get rid of this snow. So Musher's Secrets are really something we use a lot at my practice as well. Activated charcoal is good. If they were to have eaten something and you didn't get it out of the system, that can bind whatever's in there while or as it goes through the digestive tract. That's more for things they could absorb, not like a foreign body. It's, you know, like if they eat a ball or they eat a big piece of bone, that's not going to do anything for that, but it's for any toxins they might have ingested. Pain relief, you definitely do not want to use any over-the-counter human medicine. You can use aspirin. That's the only one, but there are way better drugs out there now that are safer for dogs. And so I just ask your vet to have some on hand for an acute limp sorry. If they hurt their leg while you're out and about, that's not a bad idea to give, one dose. So to have some on hand is a great idea. And it's best to just get something from your veterinarian so that you have that on hand and that it's appropriate. But yeah, do not use Advil or Tylenol or ibuprofen or Aleve. It can really, really make them sick. I also recommend having some Imodium, because if you are on a trip and the dog has diarrhea, that can be kind of a nightmare. I don't use Imodium a lot, but it's an easy thing to have. You can also get stuff from your veterinarian. Huh? Yeah. Yep, stress, probably. Yep. They know how to time it. So as a profession, I use metronidazole all the time, but we are trying to it is an antibiotic, and we are trying to get away from overusing antibiotics because of the resistance that's happening in humans and animals. And so I use metronidazole all the time, and a lot of people still do. I just recently had a dog who we tried to use something else called Endozorb, and then the dog ended up at the ER and they gave metronidazole, and then I wished I had. So I don't know, I'm struggling to let it go, but it is an antibiotic, so try not to overuse it. But that is a great idea to have. There are other products too, but you could go get Imodium at the store, and it's one tablet per about 50 pounds. So they could have 1 or 2 tablets. There are 2 milligram tablets. Goldens would have 1 tablet, and that should help at least calm the GI tract down until you could get other help. Eye wash is a great idea if they get something in their eye. They're pretty good about blinking enough to wash their own eyes out, but if there was something like that, eye wash is always great to have for you and for your pet. So electrolyte replacement, you can give Pedialyte if you want. The only thing I worry about is anything that contains xylitol. Xylitol is a sugar-free, or it's a sugar-free sweetener that they put in a lot of things, and that can be fatal to dogs. It just plummets their blood sugar and they can't handle it. And so you just really want to stay away from that. So I'm hesitant to say, I don't even know if Pedialyte has that in it, but some of the human stuff, you would want to really check the ingredients, and xylitol is XYLITOL, and that's what you want to avoid. I would recommend having a bag of lactated Ringer's fluids that you can get from your vet, or you can buy it online, but I think you need a prescription just in case if you're, the dog gets hives or gets really, really down in the dumps acutely, and you don't know if they ate something or what happened. Fluid therapy always makes everything better, and you can give fluids under the skin. It's very easy, and you can get a primary IV set and needles from your vet just to have if you're going on a long trip. And it's really easy. You just you make a little tent under their back. You kind of lift up the skin right between the shoulders where we typically give shots, or there's extra skin. You can do it anywhere, but wherever the extra skin is, you lift it up and you can kind of feel a little triangle shaped tent with your finger. That's where you would poke in the needle. And you give 100 mils per 10 pounds is a good estimate. But again, it'd be best to just call your vet or get some advice on that. But you could always have that written down if you're out in the boonies and can't get a hold of anyone. But I would highly recommend having a bag like that. And they last for a long time. Actually, fluids don't expire that much. Human hospitals throw away fluids all the time. So if you can get a hold of that, if you have nurse friends, ask them to get you a couple bags of fluids. Makes me so mad at the waste that they have. A collapsible bowl is a great idea too. Some dogs can't figure out how to drink pouring out of a water bottle. My Danes can't figure that out. So having a bowl for them, and obviously water is a great idea. Tape. This has been hard to get recently. This is 2-inch. 1-inch is probably better, but you can just rip this in half. This is a good type of tape to have too. And cotton balls, cotton swabs. I mean, if you're going to buy a little pack, they're going to have all this stuff in there. Cold and heat packs. I think that's a great idea, especially cold. If something acutely happens and they're painful, that's icing it is always a great idea. Gloves, of course. Bandage scissors are a really good idea too. They have a little notch, so you're not going to cut their skin. It keeps you in between the bandage and the skin. So regular scissors, tweezers, towels and cloths, a light. A lot of this stuff is what you would have for yourself. So lubricant to use with your rectal thermometer. Saline solution, this is basically the same thing. So you could use some of this for washing wounds and eyes, that type of stuff as well. Oh, and it does say turkey baster on here. Yes, that is the best way to give the hydrogen peroxide. And then nail clippers. I think that's a good idea to have with you if you're going on a trip too. And if you keep, I'm sure everybody does, but you keep your dog's nails short and they won't get caught on as many things. Because that's just so painful. I hate when they rip their nails and it's because they're typically too long. So, I mean, it can happen to any pet, but so that's basically everything I would have. Does anyone have any questions on first aid? Mm-hmm. Styptic is the stick, and then there's quick stop. Oh, the sticks or the powder? Oh, I don't even think it expires. I mean, I would still use it even if it was expired. That sounds, yeah, but then you can still, I mean, ours does that sometimes, and if it gets moist, it'll get really crusty and you just have to kind of scrape it out, but it still works. So I wouldn't worry about expiration. I mean, years and years, it would be good. Yes, definitely. Mm-hmm. The question is how to decide when to give subacute fluids if they have diarrhea and or vomiting. Even with diarrhea, if they're getting dehydrated, if they've had it longer than a day, so I still would, because it kind of helps stop the cycle, and then you can keep them hydrated also while you maybe hold off on food for 24 hours. Dogs can go 10 days without eating. So a lot of people get really worried if they get diarrhea and they have to go off food. But if you let that GI tract rest for a couple days, it's going to help them get over that diarrhea faster, depending on the cause. But so even with 2 days of diarrhea, depending on how severe it is, but I would probably, you can't really, they can always benefit from fluids if they have diarrhea because they're just losing it out their gut. So it does too. And if they, yeah, it does depend on the age. And then if they have heart disease, you have to be really careful. So if they're older and, fragile and have heart disease, you want to be really careful with fluid therapy too. So I'd just ask your vet, but you can always text me. Yeah. Oh, did you have a question? Oh, yeah, that's a really good idea. Wire cutter, if they get entangled. Mm-hmm. Oh gosh, yes. That could be a nightmare. That's a really good idea. A wire cutter would be a great idea. And if you're out in the woods or hunting, if you're with the hunting, yep, and you just don't see it, that could, oh yeah, fish hooks, that's a great idea. Oh, that's always a nightmare. Yes. Yep, and a brush or comb. That's right. It's like their coats magnets for that. Yes. So if you're out and about in the woods where there could be ticks, you want to check inside the ears, pull the ear flaps back, under the chin, even in the mouth. Sometimes they can be right around the lip edges. And then belly is usually kind of in the groin area, and then under the tail. If you have a fine tooth comb, that's a really good way to do, or a grooming comb, but it's pretty fine. That's a good way to check for their thick coats as well. But you always want to look, they typically go into more moist places. So ears, around the anus, armpits, groin area. And if you backwards comb the hair, you can often see a little bit better if you comb against the grain. Yeah, probably a flea comb. I don't know if it depends on your dog's hair coat, if you could get that through. A flea comb would be best. And these guys are all very well groomed. I see a lot of Goldens who aren't, and so they would never be able to get a flea comb through that thick undercoat, you know, but even just a long grooming comb that's not wide tooth, it's, you know, as fine as you can get. That's better than nothing, but a flea comb would be best. And then, yeah, that's what the, yeah. Oh, you mean to start prevention or when they attach? Always. Yeah. Oh gosh. So they can start transmitting disease within 4 hours. But often we'll see positive tick tests and nobody's ever seen a tick, you know, so you really just, if you're out in the woods, you need to look them over that, you know, when you get home. And then just, because if you see an engorged tick, that's way too, they could have transmitted disease already. So you really are looking for the tiny ones or the non-engorged ones that are even crawling still, you know. You want them when they're not attached. That's when you want to get them off. And you can use some essential oils too for, you know, there's a lot of people who don't want to use prevention, and I get that because they're toxins, but there's no great answer. With essential oils, you have to apply them so frequently, at least daily. If you're using that, you know, you can put it on their collar right before you go out hiking to help as an added benefit. And there's some natural wipes, but there's just nothing great that really keeps them away. And because of the diseases that they carry, that's the main thing. I wish there was a better answer, but there's not. Most of the time they're very safe, but we don't know what's causing, you know, increased cancer in the veterinary patients. It could be that, you know, or it could be vaccines, or it could be any of the toxins that we put in. So we try to do less at my hospital, but it's kind of the flea and tick thing is a very difficult decision for me on what to do, but yes. Oh, sure. Mm-hmm. 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 Yeah. So the question was what to do with ears when they're swimming in lake water, which, yeah. So you need a good drying cleaner that has a drying agent. Usually that's alcohol. You can make them. You can actually, I don't tell people to Google very much, but you can Google a homemade ear cleaner. It's 1/3 alcohol, rubbing alcohol, 1/3 apple cider vinegar, and 1/3. It's either water or hydrogen peroxide. I think it might be water. Yeah. Yeah. And so drying before and after. So if you put that in before, just a rinse, or you can get commercial made ones, but you want a drying agent. It's basically swimmer's ears what they get, and we've all had that. That's painful. And so if you put that in before, you're going to be a little bit ahead of the game, clean the ear out. And then I would do it right after as well. A lot of ear infections are allergy related and not really have to do with swimming, but swimming can have to do with it. So it's also timing of the year. It can also have to do with food allergies, but swimming can make it worse, so drying it out. And then I tell people, because these guys often have really heavy ears. And so if you can open, if they're laying there, flap their ears back so that they get air in there. And then I also say, use the cool setting on a hair dryer, if they'll let you. I mean, not, just getting some airflow in there, because they have ear canals that are L-shaped like this. And so you've got a vertical and a horizontal canal. There's no way you would touch the eardrum with a Q-tip if you went in there. And you have to straighten it out. For me to see the eardrum, I have to, extend the ear. But if water gets in there, here's your vertical canal. It's just sitting in there, so that's why they shake their head, and it's great. But that's why you want to actually pour some cleaner in there, and not just clean out with a Q-tip or a cotton ball. You want to get that drying agent down into the canal so that it can kind of help dry out. And then they shake out the rest. And then if they'll let you, a cool setting on a blow dryer really can help just get some airflow in there, because moisture is what is the culprit for the infections typically. So, yeah. Any other questions on that? I had one other thing I'm going to talk about real quick. Are we late? Okay. They just wanted me to touch on CBD really quick. Yeah. So basically, so right now nobody's using it with THC in it. I can't talk about that because I haven't used it actually, but even in the states that it's legal, veterinarians can lose their license if they actually talk about that. Sorry, my daughter's calling. But hemp oil is CBD oil, what most people think about CBD oil. It's hemp, it's from hemp, and it's no THC in it. I sell the brand Standard Process, but there are tons of good brands. Basically, American Shaman has shops everywhere. There's a lot of, I would just say, use one that's made for an animal so you're dosing it correctly. And then there's treats, there's oils, there's chews, any type that you can get. I feel like it's kind of like with humans. You kind of have to try it and see if it gives you what you need for your pet. And if you try one brand and you don't get the effect that you want, try a different brand, because it's kind of like I say, Aleve is my favorite NSAID for myself, but some people swear by Tylenol or they swear by Advil, and it's similar in brands. So I'd say try another if you don't get the effect that you want. I wouldn't just buy one that you've never heard of on Amazon or anything, go to a store that you talk to someone about it, and or if someone's selling it that you trust, then I would try it with them. But it's very safe, and it's really neat. I'm excited about it. It works really well for a lot of things. I usually use it for anxiety, and I feel like it's hit or miss. You can give quite a bit. I usually recommend titrating up, starting at a lower dose and then going, because your dog could be really sensitive to it and just be zonked out on a low dose, versus some dog needs twice the regular dose, So I usually say start low, see how that affects them, and you can always go up to the recommended dose. But you can always give more than that too, because it is very safe. But I use it for anxiety. I do use it. I add it. I give every seizure patient, I have them take it. It's not always, I would say it's rarely enough to control seizures by itself, but it's always a good additive, especially if I use a lot of Chinese herbs for seizure medicine instead of phenobarbital, and those two work really well together. but it often will lower the dose of the Western medicine that they need for seizures too. So I think every dog that has seizures should be on it. We treat a lot of, I do acupuncture and we have a chiropractor at our vet. And so we treat a lot of geriatric dogs with arthritis or back dogs that don't want to have surgery. And so we use this a lot too. And a lot of dogs will respond to this. It's anti-inflammatory. And the side effects are mainly just drowsiness, but I rarely see that. So that's why I say titrate up and start at a lower dose and then go higher if you're not getting the desired effect that you want. And it can be used with any other drugs, so it's very, very safe. And so I use Standard Process. I used a different brand before, but I just trust them with their supplements that they use, and they have a veterinary line, so that's typically what I do. But there's stores popping up everywhere that have it. So I just use a dog or a cat one so that you have the appropriate dose. You can use human stuff. You just need to call that company. If you have your own and you want to try it, you need to call them for the dosing for your pet so that you get that right. Any questions on that? The question was, is it expensive? That's a relative question, but I think it is quite expensive. Like this, I think is $50, and it's not a very big bottle. And so most people say, wow, that is kind of expensive. The treats I think probably are more expensive, because it's the convenience of that. But I'm always kind of shocked at the price of it, but it's also new and everybody's trying it. So that drives the price up, so it's hopefully that'll go away as it becomes more and more common, but. Mm-hmm. Yeah. 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 The question was, is it a good choice for shipping puppies or helping with the long car ride that's new or something new that that they have to be that they have to kind of be confined for a little while. What I tell people is to try it before, because you just don't know what it's going to do to your puppy until you go or until you try it. And so I can't say with confidence, yes, you're going to use this and the puppy's going to be fine. I would try it, but and it very well could be the right effect, but it's kind of like with Rescue Remedy. Sometimes it didn't work either. We still use that a lot too. We tell people to go get it, but sometimes it's not enough, so but I like it as definitely a natural alternative, just like Rescue Remedy versus giving a puppy trazodone or something, so if you have the chance to try it before, then I would definitely say give it a try. But I feel like it's 50-50 in certain dogs or on each individual dog. I can't ever say this is going to do that, but and a lot of people want to try it. And I always say, yeah, try it because it's very safe. So any other questions? Yes. Oh, yeah. Yes, and I realized it's me touching this. So the question is, what about for thunderstorm anxiety? Would that work? Definitely something to try. I use Composure Pro a lot. I don't know if you've heard of it. It's a all natural treat for thunderstorm anxiety. It has theanine in it and colostrum, which is milk protein that calms babies. Theanine is a calming amino acid, and then tryptophan, which is the amino acid that makes us sleepy after eating turkey dinner. And so it just kind of takes the edge off. That's can be used regularly. There is Composure, but I like Composure Pro. It's better. It works better. And it doesn't make them flat out or anything. It just takes the edge off. I have a dog that I use it on for thunderstorms. You need to give 3 times the regular dose though for thunderstorms. So I think you can get it on Amazon. Oops, I'm sorry. We sell it at our practice. It's a really good option. And that with hemp oil would probably be a really good option if your dog, it depends on how severe the thunderstorm anxiety is. My one non-Great Dane is a mix, and he is like 80 pounds. He'll get up on the bed and, and the whole bed is shaking. And if I give the Composure Pro 3 times a dose, he's really good. He just lays there, still can get up and do everything. And he's not so just zonked out like on trazodone, but some dogs need that too. So yeah, Composure Pro. It's made by there's a brand that they make a lot of supplements. It's a common brand. VetraScience, I think. Yeah. I don't know if you can get Composure Pro online. I know you can get Composure, but I really like the Pro. So with the hemp oil or CBD. Or American Shaman is good. I mean, they're just everywhere. They're trusted. I mean, there's other brands, but I just wouldn't pick one random one that was the cheapest online. That's never a really good option. And if it's pretty severe, I would try, hemp oil and the Composure Pro, but Composure Pro on its own might do the trick. But yeah, I do like it for that. No, but yeah, it's an hour or two. So I know it's kind of the same with everything. So if they usually know it's coming before we do. So if they start acting weird, then give them something, and check the weather. But the sooner you do it, the better. My suggestion, if a thunderstorm comes up all of a sudden and you weren't aware of it, I'd give extra whatever you're going to give. It will kick in faster on these types of drugs, hemp oil or Composure Pro. You want a big dose right away. You don't want to just keep giving little doses because you need to kind of build it up and to calm them down, so if it sneaks up on you, I'd do an extra dose. I wouldn't skimp. Probably a couple years. There's an expiration date on those though, and I'd still use them. They just get kind of dry. I worked in the pharmacy and vet school, and they told me that the pharmacist told me that they only have expiration dates on typically because they're going to change the label. It's not that the pills, especially pill form, that doesn't, it doesn't just stop working. It can lose effectiveness, but if it's in a pill, that's pretty stable. Liquid less so, and treats probably less so, but it's never gonna, these types of things don't typically spoil where they're going to make your pet sick. They might just be less effective. So with medicine, I'm usually a couple years, I'll still use something afterwards of my own. I would never sell expired meds, but I would use them myself on my pets, if I had something at home from the vet. It's a chew. It's like a triangular chew. Yeah. Most of them like it. Cats can take it too. And yeah. Any other questions? We're checking online. Any other? Okay. Well, thank you guys so much for having me. It's very neat. Yeah.